what we've got going on, we find during our board meetings. So we will be not using chat. We will, however, be asking you to raise your hand when we get to the point of questions and comments here in just a little while. And to raise your hand to participate, you hover over the participant button, I guess for lack of a better term, sorry, at the bottom of the Zoom page. And if you click on that, it opens up the list of people participating. And down at the right-hand bottom, there is something that lights up when you hover over it, and that's raise hand. And raise hand gets you in the line to share your question or comment. So that's how we will keep ourselves in order and making sure that everybody who has something that they want to say gets to say that. So we will we'll be getting to your opportunity here in just as quickly as we possibly can. I want to make sure that everybody understands that tonight's meeting is focused on elementary. And we're really going to try to limit ourselves to the elementary conversation. Monday night at the same time, via the same link, we're having our meeting on the secondary system. So that'll be middle school and both high schools. And then on Tuesday night, we will have a meeting that provides translation service in Spanish, and we'll cover the range of elementary through the secondary. So Mr. Germani, would you mind just repeating that last little piece in Spanish for us? So just in case we have any Spanish speakers in this meeting who would prefer the translated meeting on Tuesday, that they're aware of that and can tune in then.
Sure. I forgot I was going to do this, so if I butcher this a little bit, I apologize. Muy buenas noches. Queremos ofrecerle la bienvenida a estar con nosotros esta noche. Esta junta se va a tratar de las escuelas primarias. El lunes vamos a tener una junta que se trata de las escuelas secundarias, o sea, las dos high schools y la C.A. Jacobs. Y el martes vamos a tener una junta completamente en español. Tiene la bienvenida de quedar con nosotros esta noche, pero esta junta va a estar en inglés. Repito que el martes vamos a tener una junta que está totalmente en español. Gracias.
Thank you, Mr. Germani. Appreciate that. A couple other things I want to just get out there for everybody here at the start. And it's great to see we're up to 131 people in the meeting now. So thank you, everybody, for continuing to join us. So a couple things I want to really help everybody understand as a frame for tonight's session here. So first off, we have not made our mind up in any way, shape, or form how we're going to open. We are looking at a whole range of models that Nick will talk to you about here in the next little bit. We posted the weekly update on Monday, and immediately some people took that information as we were doing a full physical reopening and how could we do that. I'm here to assure you that we will not have a decision about how we're going to reopen until Thursday night next week, April 16th. April 16th, good gosh, that's my wedding anniversary. There's meaning behind me going all the way back to April. And I actually spent my wedding anniversary this year in a governing board meeting. So my wife is still chewing me up about that one, right? So on July 16th, actually, the month that we are currently in. So next Thursday, starting at 6 o'clock, will be the board meeting. We will have another presentation, and feedback from these sessions will be included in that presentation. And the board will make a decision that night about what our reopening models will look like, okay? So I know people always get suspicious. This is a done deal. I would tell you, for the three of us administrators who are in this meeting, we don't know. I don't know sitting here tonight what the best way to go is. And part of that is based on the changing conditions out there that we all, if we watch any news, get to be aware of. I have a little Post-it pad I'm keeping. So if you can read that, it says 21. And the next one says 20. And that's the number of working days after today that we have until school starts. And if you go backwards 21 days, our status was really different. And I would have told you, I think we're going to be able to come pretty close to a full physical reopening with lots of precautions in place. And some people would choose to do distance learning. Today, that full physical reopening with everybody present, I don't think is realistic. And 21 days from now, who knows where we'll be, right? So it is certainly conceivable that the governing board can make a decision next Thursday and circumstances change a week, 2 weeks afterwards, and we alter our path, right? So I think one thing that we have learned throughout this whole ordeal with this virus is that the change is constant, that there's absolutely no way that anybody, I think, can accurately predict what's going to happen, never mind next week, but, a month from now even. So I just want to really reiterate that we do not have a model in mind as our final choice at this point in time. We're looking at all kinds of options, which you will get a sense of tonight, I hope. The other thing I want to encourage all of us to do is it's to be nice to each other, I guess I would say. This is my 32nd year working in education. It's my 22nd in Dixon. It's my 9th as the superintendent of schools here. I have dealt with plenty of difficult issues during that time. None of them as difficult as what's brought us together tonight. And there's a decision will be made next week. And what we can guarantee is that a large percentage of people are going to be unhappy with the decision. Hopefully that large percentage of people is actually smaller than the percentage of people who are happy with the decision. People are gonna, there's people who are just not going to be comfortable or are going to be upset with what we decide. There are student issues, matters, interests in this. There are parent issues, matters, interests in this. There are staff, the same is true for staff. There are all these interests, and in some ways they compete against each other. Nobody involved in this, and I apply this to you, is trying to do the wrong thing. Not a one of us. Not a one of us. We all want what is the absolute best way to do this. And there's going to be disagreements about what that looks like in the end, exactly what the best way to do this is. And I'll tell you what, I am not a scientist. I am not a physician, any of those types of things. I'm an educator, and I've never been challenged in my career with anything like this. What we want to make sure that we can say at the end of this is that we can defend the process that we took to get to the decision. Now, we have spent hours and hours and hours in board meetings. We've spent hours and hours and hours in meetings in this district office building where I'm sitting tonight. And we've had more public input through these Zoom meetings than we've ever had before, which is fantastic. And before we got to Thursday night, it was important to us that we offer a meeting just for parents to be able to ask your questions and make your comments, because the board meetings aren't necessarily, they're much more formal. And tonight we want to treat this as an informal way to hear from you folks. You will be able to watch that meeting next week, and you will hear me report on things that come out of this meeting and come out of Monday's meeting and come out of Tuesday's meeting. So I want to make sure that you understand that, and that we all presume positive intentions as we go through this, and that we do not engage in some strange form of cannibalism, tearing each other up when a decision is made next week. Okay, Mark, I don't know if I can share my screen at this point in time, but if you can hook me up with that. I'm going to give you just a little bit of background information here to get started.
You should be ready to go.
I am ready to go. Thank you, sir. All right. So just a little bit of background information, and then I'm going to be quiet for you, at least try to. So it's taking my time. So we have had board meetings every 2 weeks since the closure occurred. And for the first little while, we were focused on how were we managing the distance learning and the closure. And then by May, we had moved into the reopening planning. And so some of you have been in those meetings. I recognize some of the names and or faces. And for others of you, this is your first time joining in. I just want to assure you we've been working on this a bunch. A couple of weeks ago, we had a parent survey out there. We had 944 people participate in that. Pretty good turnout. That represented almost 1,400 students, because parents could say, if let's say they had an elementary kid and a middle school kid. So pretty good turnout. We had put that out on via email to parents, robocall. It was out on Facebook, our website, all those locations. So hopefully you saw that and participated. Like I said just a moment ago, we want to provide this opportunity for you folks tonight, and it will be shared next week. So I just want to talk to you a little bit about things that came out of the survey. And this is a page that I used last week at the governing board meeting, where I did a full report on the survey. So we asked 3 different types, the wording on 3 different questions all got to the same point about a physical return to school. And in all 3 of those, we had between 70 and 73% of people who responded saying that they wanted a physical return as part of the reopening. And for some of those folks, it was full reopening, and for some of those, it was in the blended or hybrid model that you'll hear more about tonight. And that blended model is a combination of in-person and distance learning. So we were, another way of stating that, 27 to 30% of our families said they did not want any physical return to school. Okay, now want to acknowledge that survey closed on July 1st, and things have continued to escalate with regards to cases, certainly across the country. It does look like things in Dixon, which had jumped significantly for several days in a row, are now, and I don't know today's numbers, but had diminished down to maybe about 5 new cases a day, which is very concerning still, but we were up near 20 for several days. So the survey closed off on July 1st, so it doesn't capture any feelings that have emerged since then. And if I had to place a bet on it, I'd put my money on the fact that parents are more concerned now than they were when that survey closed. Okay. We know we're going to have some distance learning program available for families who just cannot, for whatever reason, have their child return to school. So if you're here tonight just wondering, will there be an option for my child just to be in distance learning regardless of what else we decide? That answer is yes. Okay. We know that before we open doors for people to return to campus, and this applies to our staff just as much as it does to students and parents, that we have to be able to communicate to you really, really clearly what's going to happen in terms of safety protocols and how we're going to do our very best to keep people healthy. And the final one I just already said, pretty much that we know the trend and what'll happen between now and August 10th when school starts will impact what people decide to do in terms of sending their child back to a physical reopening or choosing the distance learning option only. Okay, so we are dealing with some requirements under law that were part of the budget adoption that happened back in late June. And SB 98, so Senate Bill 98 is what was adopted here. And the language in here is very clear that there must be a physical reopening of schools to the greatest extent possible. So that's the exact language from the bill, to the greatest extent possible. What does to the greatest extent possible mean? It means something different to every school district that is out there. That greatest extent possible is a local determination that should fall within the guidance that is coming from the Centers for Disease Control or the California Department of Public Health or the Solano County Department of Public Health. And what I'll tell you is that in all those venues that we're seeing guidance come from, none of them are mandates of you must, you shall, you have to do this. They're broad guidance which allow for decisions to be made at the local level. And we know that actually earlier in this week, we were anticipating the Centers for Disease Control, CDC, to issue new guidance for schools next week. And I can't remember if it was today or yesterday, that changed. CDC will not be offering new guidance. I do participate in a weekly meeting with the other superintendents in the county and Solano County Public Health to get the updates. But the expectation is that there be a physical return to school. Distance learning can happen in two ways. One, so while we are being told there has to be a physical return to school to the greatest extent possible, you could be in a situation where there is a district-wide or school-wide level order that we have to be closed and do distance learning. We're being told that those are very, very unlikely circumstances at this point in time. And I point out that when we closed in March, and all the districts in the state pretty much closed right about the same time, that was not based on an order from public health. That was based on the determination from districts that it was the right thing to do to close at that time. And the other element here of distance learning, anyone who is medically fragile or is at risk is eligible for a distance learning program. Okay, distance learning will be different than it was in this first closure period. So we have to be able to guarantee every student has a device and access to internet. Grade level has to be substantially equivalent to in-person instruction. And there was a lot of effort to make that happen here beginning in March, and it was really difficult to do in a lot of ways. Supports for all these different groups of students has to be provided, and daily live interaction with teachers and peers, whether in person or via electronic means. And we know that was a concern for lots of families during the closure period of wanting more contact with your child's teacher or teachers. We know that the state is waiving the typical number of instructional minutes that happens in a year, and they are expecting that we meet the minimum instructional time, which is 4 hours a day for a student. And that can be a combination of face-to-face, in-person, whether face-to-face via internet or in-person physically. But it's also the time where student may be working independently on an assignment at home does get calculated into that, that 4-hour daily requirement. And we also, finally, we're gonna be taking attendance every day because we have to. And one of the provisions in law is that when a student is absent for 3 days in a row, that we have to make an outreach and try to find out what's going on. So those are the new expectations, and they do, like I say, emphasize we all know the best thing for students is to be in school. I think the safety element is acknowledged in that language around the to the greatest extent possible, because we know we could not just throw the doors wide open on August 10th with no provisions for safety and health protection. And the distance learning will be improved from what we did. So I'm going to give it to Nick at this point in time. He's going to talk about some of the models. Then Mark will do the safety stuff, and then we're going to kick it wide open for you. And you can already raise your hand for a question or a comment if you want to get in line. And there's the first one up. So you can do that at any point. You can also take your hand down if you get your question answered, or if you get shy, or any of those types of things. So thanks. Nick, it's your turn.
All right, good evening, everybody. So what I'm going to present here in just a moment are some of the considerations that we have moving forward with the different structures. So I believe, Mark, you've given me permission to share my screen. Yeah, just give me a moment.
Correct.
Okay, so what I'm not going to share with you right now are the different models that we're mocking up. Tonight really is about hearing from parents and community members about what they'd like to see, should we need to go to any of these different stages. And I think what we'll probably wind up doing is spending a lot of time, if you see this this yellowish section here, this between 2A and 2B, I think we'll probably spend the most time there once we get going. But first I want to explain the different columns here. So column 1, that red column there, is really what we're calling distance learning 2.0. And that's if we're not able to come back to school physically at all. Every kid needs to continue learning from home. 2A and 2B are both what we call hybrid or limited models, meaning some students are able to come back to school for some of the time for safety reasons. Column 3 and column 4 are very similar. Those involve 100% of our students coming back. The big difference between 3 and 4 is, in 3, we still have an active pandemic going on. We'll get into what that means. And level 4 is COVID is gone, and we can all return to life as we used to know it, and move on happily with our lives, right? I'm not going to spend too much time on 4. We know what 4 looks like. 4 look like the blue column. We know what that looks like. The others are a little different for us. So I'll jump in first with this red column here, and really the key elements of any model that we consider here. Again, no students would be allowed on campus. The most important thing to note here is that this model will include significant synchronous and asynchronous learning activities. So those sound like fancy words. They're really not. Synchronous just means that when that students need to log in at a certain time to be face-to-face with their teacher or whoever is supporting them. As an example, this is a synchronous activity that we're doing right now. This is when this meeting was. You guys logged in. We're all having a conversation together. Asynchronous is similar to what a lot of our students primarily experienced in distance learning 1.0, which is a teacher would push out an assignment and the kid is expected to do it at his or her leisure or when it's convenient for them. That synchronicity and a significant amount of synchronous learning is a big change from where we know we were in the spring. We feel like we're prepared to do that, or much more prepared to do that, especially with some more professional development of our teachers. And what that means really is that second bullet down, which is that students and parents can expect a lot more face time with their teachers, which through the surveys that we've collected, as well as just the anecdotal conversations we have with folks, I think that's where some of the frustrations with some of our kids and parents were, is they just wanted more of that time with their kid's teacher. Totally get it, and our teachers want that too, frankly. I want to point this out, that the standards of the state of California have not been diminished. Grade level standards would remain in effect. We need to continue pushing forward with our standards. I would be lying to you if I didn't say that's more challenging in any column but green or blue. We know that it is, but it does not excuse us from having to meet those. As Brian mentioned, we're compelled by law, but also just ethically, to make sure that we're providing technology support for our families. That means hardware, of course, but also as much as we can provide it, internet access support, etc. This higher accountability for students and staff. We intend to, really the accountability for staff piece comes from the requirement that they're in front of kids at certain times. And really, it's not so much that we have to tell them to do that, as so much as we're empowering them to do that, giving them support and structures that they need to be able to do that. Again, we don't anticipate any pushback from staff on that, but that will be the expectation. And as for students, assessment, grades, etc., in the first level of distance learning really was fairly challenging for a number of reasons. but we're having a return to normal there, as it were. Assessments are back in the game, as are grades. That's more a question for our secondary folks, but certainly for our elementary kids as well. Then we get into these hybrid models here, right? So this kind of this beige section here. Again, this is some students returning to school. You can see that in the orange column here, that would be 25% of our school population, the yellow being 50% of our school population. I haven't seen or heard, frankly, too much chatter about the 25% of school population, but that is absolutely something that the board may consider. And there's some, there may be some good science behind that too, depending on where we go with things. But the first thing we want to note is that safety measures are in place during this time. These may include, but not be limited to, and I know Mark will get into this more, all the things that are listed there. I'm not being prescriptive on those things now. I just want people to walk into any conversation we have with as much knowledge as they can have. So that might be masks, obviously frequent hand washing, socially distanced classrooms, which might reduce the amount of collaborative work that your students have become accustomed to. Limited parent access to campuses. So for an example, no parent volunteers in our kindergarten classrooms. Again, just limiting the amount of contact that we may have to the virus, and then the elimination of large group activities like field trips and assemblies, etc. This is really where I want to emphasize this. Right now, we are considering a number of different schedules and models should we return in a hybrid format. This is probably where the most conversation is. Those of you who pay attention or are paying attention locally know that Vacaville approved a model on Tuesday night that they're going to return to that's hybrid. I've had community members and teachers reach out to me and say they like that model. That is one model. I will tell you that any of the models have pros and cons, which means that by having cons, none of them is perfect. Any of these models has some sort of a flaw, but they all have certain advantages. And so as we talk tonight, what I'm hoping to hear from you is, and I think the board as well is hoping to hear some direction for us for those different models. And I'll get to some questions here in a moment for us to consider. In a hybrid model, obviously students are not going to be able to attend school as many hours as is typical. So they'll not only be expected to complete work at school, but also at home in a distance learning model. That's why it's called a hybrid return. It's some distance learning and some in-person learning. In this model, we will be able to provide some of our direct supports in areas like English language development for our English learners, RTI intervention for our struggling readers, and special education. So again, sort of in person, getting that work done is an advantage to any of these. And then as Brian mentioned, we're still required to make sure that our students get 240 minutes of instruction per day. That can be blended, as he mentioned, between what's happening in a distance learning environment and also what's happening on campus. So any model that we come up with, this 240 minutes is a requirement. We don't get to fudge that at all, nor would we want to. 4 hours already is far less than what kids typically get in a regular schedule. So we would even be looking at models that would hopefully push us beyond that 240. Again, I'll get to some questions here in a moment for us to think about with any of these. This green column here, this lime green column, if it's on my screen, really this is a return to normal, but with all of the safety precautions, or potential safety precautions, I should say, that are listed here in this beige column. So, green is, it would feel pretty normal to our students, but again, things like large assemblies, things like collaborative work in class, things like field trips, those would be far more limited than what we had. So to say that green is a return to normal, even though kids are on campus, it really wouldn't be. It would be something else. Again, I think in an ideal world, we would take green over yellow, orange, or red. But I don't want to steer people the wrong way and say it's just a complete return to normal. Blue is the complete return to normal that we all hope we get to sooner rather than later. So some questions to really think about. In the red column, what support do parents need to best support their students in distance learning 2.0? We've heard from some parents that they would like some training in something like Google Classroom if we move in that direction. As you can see, more of the questions, like I said, a lot of the conversation we think will center around some of the hybrid models here. Some things to really think about. If you were paying attention last Thursday, I did present one of the schedules, and I knew that it was just one. and wanted to sort of get that out there as some initial feedback. How important is it to our families that both the elementary and secondary hybrid models have students in the same households attending school on the same day? What I mean by that is this. The model I can easily, or not easily, the model I could put a model together where if you have a student who is an elementary student, a middle school student, and a high school student, and the day that they're going to school, they can all go to school on a Tuesday and a Thursday, as an example. But for some families, that's not important. They'd rather be able to have in doing that, we would limit our options for each of those levels. And it may be more advantageous to more kids to have a different model for elementary because that's what's appropriate for them at the age level, and a different one for our secondary kids because that's what's more appropriate for them at a given grade level. So the question there is, how important is it to you that we really create that consistency across grade levels for families? Another question to consider, would you rather have your student have daily contact with his or her teacher for a shorter duration? Some of that might be in person, some of that might be virtually, or longer sustained contact with your student, even if that means she will not see their teacher every day. The reason I'm asking this question, there's a model out there where we can say your kid goes to school all day on Tuesday and all day on Thursday with half of his or her colleagues, or peers, pardon. If we do that model, though, it's really impossible for us, for the students who are not on campus those days, it's impossible for us to guarantee teacher-student contact for kids who are not on campus. So it could be that your kid sees their teacher for a full day one day and doesn't see that teacher at all the following day. Obviously, in doing that, there are some advantages and disadvantages. So just a question to consider. And then finally, if not attending school daily, would you rather your child stays on campus, your child stays on campus, be clustered together or spread apart? For example, if your child is to be on campus for 2 or 3 days per week, would you rather those days be back to back or every other day? I will tell you right now, without getting the details, there are advantages to either one of those models. This is really a family convenience question, frankly, for our families out there. All right. And then, of course, the green column, and I think this will come up a lot when Mark is giving his safety presentation, is what is the district going to do for you to feel safe sending your child to school with his or her peers? So much there, obviously, and that really has to be our first priority for our kids and staff.
Yep, it is. Great. Thanks, Nick. Continue to raise your hands, folks, if you've got a question that's popping up along the way. And now I'm going to invite Mark to take over the screen here for a minute. And sorry, the raise your hand is through the participant. If you click on the participant tab button at the bottom of the screen, and then in the right hand bottom corner, it's the raise the hand button that you touch, and that gets you in line. Mark, it's all yours.
Thank you so much. I will be brief because I see lots of people with hands up. So real quickly, I will go through these slides. So this is the safety aspects of reopening schools. And I'm sorry, I've got my screen to monitor this thing open and it's getting in my way. So what I'll talk about first is the group of items we'll call personal protective equipment. So this includes cloth, masks, or face shields. We have already reached out and we will be using a laundry service for our face masks. They will verify that they are properly cleaned at the right temperature and the proper soap is used. They will then be sterilized and returned to the school sites in sterile packages for our students to then use. Specific requirements for masks and or face shields have not been set yet, but we will be providing all that for both staff and students. Each classroom and throughout the campus, we will have a hands-free antibacterial soap. So right now, CDC is saying the best thing to do is wash your hands for 20 seconds. We don't have enough sinks throughout all of our schools and classrooms to do that. We will be bringing in some hands-free hand washing stations to be placed on campus, but we will also be using antibacterial soap. The company we're using is the same company that is supplying our masks, which is Centros. And the brand we'll be using is Germex with a 62.5% alcohol level. It is important that every parent know that during the day, we would like students to wash their hands or sanitize their hands frequently. This will be on posters all over the school and repeated by teachers, but when they first come on campus, they're gonna wash hands. They're gonna wash their hands before and after lunch, and obviously before and after using the restroom. Each classroom will have an ample supply. We've already got a lot of this in place. I am picking up our allotment that the state has given us either tomorrow or Monday. I'm waiting for the county. We will have plenty of tissues, paper towels, hand soap, antibacterial soap, and cleaning wipes. So this portion of the presentation are those items that are in the PPE equipment area. Sorry, I'm waiting for my slide to change. The next are preventative measures. What are we doing to make sure that our rooms are clean and disinfected and healthy for staff and students? So the first thing is we've gone out and purchased whole room foggers that can be used in a room to dispense the proper levels of disinfectant when we have a confirmed COVID-19 case or cases. All classrooms will be cleaned and disinfected daily using proper cleaning techniques and handheld electrostatic misters. Those are new items that we purchased so that instead of wiping everything clean with a disinfectant wipe, we will be able to use the misters to clean the room. Restrooms will be cleaned and disinfected twice daily if we're in a full day schedule. If we have half-day schedules, they will be cleaned obviously once a day. Again, we'll have portable hands-free washing stations located throughout the campus. We will use multiple entrants, typically assigned by grade level or for our secondary by the location of your first period class, so that we can make sure we don't have a lot of students congregating together in one area prior to school. Each school will have plenty of signage out to direct students on how to enter and exit campuses and enter and exit classrooms. So if you've been to Safeway lately, you'll notice on the floor are arrows directing you that you should head one way or another down an aisle. That'll be similar to our classrooms. When we cannot achieve a 6-foot social distancing in classroom, we will use plexiglass barriers. So typically this will be 4th grades through 12th grades. The younger grades where we have class size reduction, we can amply space students to reach that social distancing. Each school site will have a quarantine room for a staff or student who are showing signs of COVID-19 so that they can stay there until someone can pick them up. That is all I have for this part. I think right now, if I'm looking, we have quite a few people waiting to ask questions.
Great. So what we'll do here, what we've gotten fairly good at via our board meetings is Mark will be checking out that list and he will work his way down it. If you open up the participant list, you can actually see where you are and anticipate getting called on. And I'll tell you just a couple quick things. We welcome your comments or your questions. Some questions, excuse me, we'll be able to give you a definitive, quick, clear answer on tonight. Others of them are things that we haven't reached a final decision on yet, or waiting more guidance. How much will people have to wear masks? What grade levels, right? We're all concerned about the littlest kids trying to wear a mask as just one example of something that we haven't made a decision on yet. And some of these things are things that will be determined after the board decides on Thursday night, not prior to. So the board we won't be asking the board on Thursday to make a decision of what grade levels should be wearing a mask. We're talking about the model of the schedules. Is it full reopening? Is it a hybrid approach? Is it full distance? Those types of things. Other thing, and I meant to say this earlier, and this came from Dr. Mateus, who is the director of Solano County Public Health. In a meeting a couple of weeks ago, this just really struck me, and it's kind of guiding my my work since. He said, just on the basis of science, there's nobody anywhere who can fully eliminate the risk attached to the virus. Nobody anywhere, I suppose, unless you're in some sort of highly secure lab in very, very controlled conditions. But, we see even in the hospitals and ICUs where employees are wearing very extensive PPE, that issues still happen there. So what we have to work to is to minimize the risk, right? There's no way we can eliminate it. And so we are working together here to try to reach decisions that, in our best judgment, minimize the risk to a level where we can bring kids and staff back to school, where parents are comfortable with returning their child into the school setting. So we can't do the impossible. The impossible is to eliminate all risk. What we have to do is our best, right? And so with that, Mark, you want to start calling the roll?
I'm going to ask that Mr. Schwab go first, and I will let everybody know that today's number, we jumped up 5. So we're 116 confirmed cases in Dixon. So,
Thanks,
Mr.
Mark.
Schwab, are you ready?
Yes, sir. Yes, sir.
Thank you.
All right. So I'm actually work in the medical field, and I have a lot of contacts in Sutter Health, Kaiser Permanente, most of the hospitals around the area. And I just want to first say that it's unfortunate that we cannot trust the numbers that are out there of how many people are getting COVID-19, because there are doctors out there telling nurses to tag people as COVID-19 patients when they're really not, for the government funding. So it's unfortunate we can't trust all those numbers. My comment is, or my suggestion is that, we're Americans. We should be able to choose how we go about our lives. If there are parents that, want to do the full distance learning, I totally support that. For parents that are comfortable with sending their kids out, I've been through Dixon. Nobody is wearing masks except for like Walmart. And the extra numbers that we're talking about, saying people are getting new cases, you got to take that with a grain of salt, because they're not really reporting how many people are recovering. So is it an option for us to make the choice ourselves? Because I don't want my children to have to go to school with plexiglass, like quarantined animals. I don't want them to have to wear masks, because then they are not breathing straight oxygen. So that's not healthy for them. And, if they're going to have to wear masks, I'm going to be honest, my children will be going to homeschool systems. And I know a lot of parents that feel the same, that why would we even sign up for your school if we can't have our children actually participate in the school? be social. I mean, we're human beings. We cannot be confined like this. It's not good for our mental health and our kids coming up in this, the way society is right now, of this fear of what some people call just another strand of the flu. We can't live in fear of a sickness. Everyone gets sick at some point or another. This is not killing people like the bird flu. It's just not to that extent. So, I mean, what I would like to see is parents making the choices for their own children.
Great. So that message then gets passed on as a voice asking for individual choice within the structure, and certainly there will be individual choice with regards to distance learning and to what degree, if any, we can accommodate individual choice within, let's say we adopt a hybrid model. That would have to be, that's up in the air still, to be real clear with you. All right, thanks. Mark, who's next?
I have someone named iPhone.
That is me. Hi. Can you hear me?
Yes, we can.
Okay, hi. Sorry, I am on my iPhone, unfortunately. I'll make mine really quick. I just have a question. If my kids, I'm aiming more for the at-home distance learning. But if for whatever reason I decide that, oh, you know what, I do feel safe sending them to school, will it be easy for me to transfer them back in, or vice versa, put them in and then decide, you know what, I want to pull them out? Oh.
Yeah, it should be, right? We are not in of a mind where we want to deny parents their choice here. What I would say is, staffing and assigning students to teachers will be a challenge, as we're trying to operate two systems, obviously. And it is possible that a family who goes from distance learning wanting to return into some in-person might not be able to get to their home school, right? So it could be that classes are filled in such a way that, oh, you're in the Anderson boundary, but we're going to have you go to Gretchen Higgins because that's where the space is, right? So that type of circumstance is possible, but certainly we have to account for parents who may start in one model and want to go to the other. Okay.
Thank you.
You bet. Who's next, Mark?
Mrs. Settlemoyer.
All right, good evening.
Hi, can you hear me?
Sure can, thanks.
Hi, I'm actually new to the district. We just recently moved here. And my question / comment is more or less that I'm not in the district's like email phone call system yet. I have registered at my home school, but I'm not receiving those types of notifications. So if there is future surveys or information that's being branched out to parents, I am not receiving that.
Okay.
So if there's a way that I can be input in the system as well as any other new students or families to the district, I would really appreciate that.
That's a great heads up. I hadn't thought about that. So
Sorry, Brian, I do believe now that summer school is done, that Keith is ready to roll over. So next year, students will become active and then hit that list. I'll make sure that we do that a little sooner than later.
Yeah, thanks, Mark.
Yep.
And if you continue to have an issue with that, we do have an email address, an all-purpose email address. It's just schoolclosure@dixonusd.org. So schoolclosure@dixonusd.org, and encourage anybody with a question or something they need clarified to use that email address.
I
Great.
have an email address already, and I just want more or less to be like involved in the mass notifications that go out.
Absolutely, yeah.
That I'm in the know of what's going on.
Great, understood. We will address that. And thanks for servicing that. All right, who's next? Mark?
I have Dr. Curry.
All right, Dr. Curry.
Yes, the reason why we're tuning in is basically we have a TK student who's going to be coming to your area for the first time.
Great.
And we understand we got the notice that you're having a meeting for the elementary, and I presume that that's elementary.
Yes, it sure is.
So we're just concerned about how that TK is going to look. I think you may be, from what I'm hearing, you're looking at more traditional students, maybe first through sixth or whatever. But could you give us some information about the TK?
Sure. What I'll say, and sorry for our previous speaker as well. Welcome to Dixon. It's a great place to live, and a great place for kids to go to school. I've got a couple of UC Davis graduates who are out there making good lives for themselves after going to school here. So we welcome you. So what we know, especially about the little ones, is that they need to be with a teacher, and they need to be with each other, because so much of that early time in school is about socialization and really learning how to do school. Everybody needs a connection with teacher and peers, but especially the young ones. And so as we're working through potential models, we really do have a lot of concern and are thinking an awful lot about how can we ensure that the youngest kids especially get the opportunity to connect with the teacher. One of our staff members said in a board meeting, we were fortunate that when we closed, it was March, and all the relationships existed between teachers and kids already. So you were not starting from scratch with the very big challenge of distance learning. If we start in distance learning, I really worry about the ability for kids to get engaged and connected both with their teacher and with each other. TK will be offered regardless of what we're doing. It is our intent, our primary interest is in having it be in person as much as is possible, right? Like that phrase I used at the start. And the room would be full of the kind of safety and health protocols that Mark was talking about earlier. Once we get our decision made next week, then it allows us to actually decide exactly how things will be set up, right? If we're on a split model, kind of that AB model that Nick talked about, where half the kids come, there'd be on average 12 kids in a TK through third grade classroom at a time, right? So that feels pretty manageable for me sitting in my chair. Still would be a concern for lots of parents, I understand. And if we're in a group of 12, I'm really confident that most of the things that are part of the normal TK kindergarten curriculum are going to be easy to deliver. So hope that touches enough on your question to help you out there a little bit.
May I have a follow-up?
Of course.
What is the teacher ratio for the TK, if that's the case?
So, all of our TK through third grade classes are 24 students to one teacher. Sometimes that number is lower. There may only be 20 or 22 students in a class. Sometimes it can be a little bit higher. It could be 25 or 26. And so that is the typical maximum. Somebody with an iPhone needs to go mute. Thank you. Sorry, I lost my train of thought. I lost my train of thought there. So the normal ratio is 24 to 1. And if we were in that kind of that AB model, you'd be talking about 12 to 1.
Thank you.
You're welcome. Mark, who's next?
Have Jenny next.
Jenny, please.
Oh, thank you.
You're welcome.
You answered one of my questions, because one of my questions was going to be about class sizes in each of the models. So I think you kind of answered that.
Okay.
I know I work at a nursing home in Sac County, and we are tested for COVID every 30 days. And then if there's a positive case, the staff is tested weekly. Has Solano County said anything about regular testing for teachers and staff at the schools?
No, they have not recommended that. We've asked that question pretty specifically, actually. And Dr. Matias spoke to that, that that in general, and now especially with the increase in cases, you know, they're suggesting testing at this point in time for people who are showing symptoms or work in a high-risk environment, such as you do. The availability of tests has certainly tightened up here, as we've been told, and I've seen on news coverage as well. So there is no recommendation from any level, CDC, California Public Health, or Solano County Public Health, that we test. And frankly, we wouldn't be able to do it, right? There's no way that we could administer that. And at this point in time, public health would not engage in that either.
Okay. Thank you.
No, thank you. And stay healthy out there in your work.
Thank you.
Who's next? Mark?
We have Ryan next.
Ryan, please.
Ryan, are you out there?
All right, why don't we
I
move
don't
on?
see Ryan. So
Okay.
I have Clackham next. Would this be Betsy?
It is, it is.
Hi, Betsy.
I'm trying to fix my video so I can be polite and show you my video. Hi,
Hi there.
I just wanted to make comments that my kids, I've been having them practice with masks, and I have little ones. So other parents out there that have little kids, I want you to know that this is something that we can practice. We can work on. This is my daughter's mask right here. We have two. This is the one that fits her. There's a lady in town that makes them, and she did a great job. I'll show you how it works. Today she played in the park today for 2 hours with her little friend. She practiced sitting apart from her little friend, 6 feet or more, while they ate their snack and stuff. And they played dollies. And the whole time they played dollies and dressed their dollies, they were outside and they wore their masks. And I have done this with my last year 4th grader. Next year he's going to be a 5th grader, and my little girl is a 2nd grader. Next year she'll be in 3rd. And it is no problem. This is something that we should practice with our kids. If it's required that they're going to have to wear masks in school, then we should practice it in advance. And it's not something that's difficult to do. I would also say that for people who say that, you know, we should make our own choices, the thing is that with a public school district, we have to take into account other people and their needs. And that's the nature of living together, especially in a small town. And I think a lot of us moved here to live in a small town on purpose for a reason. And I think we need to honor that and really think that this is nice. This is good that our school district is taking the time to explore options. I was surprised that you were going to be laundering masks for people. I think that's fantastic. But I did have a question on the funding that you're receiving.
Mm-hmm.
I am deeply, deeply concerned that our schools are not receiving enough funding to support coming back and to help pay for you to have extra staff to, you know, sanitize our classrooms, to pay for this laundry service and all the other things that are going to need to happen. I'm really concerned about that.
Yeah, thank you. We are too. And everyone should be, right? So in one of the levels of the federal assistance that was distributed to the states was something called CARES, COVID, I don't remember all the acronyms. So we're seeing about $715,000 come from that allotment of money that will that we actually have to spend by December 31st. It's a real fast track to expend funding that we receive. And that can be used for virtually anything related to the virus. So cleaning equipment. We would not spend that money on staff unless it was a short-term short-term position. You don't want to get a permanent position out of temporary money. Is just a bad practice. So you can spend it on cleaning stuff. You can spend it on supplies. You can spend it on additional teacher training. You can spend it, we're behind because of the closure on assessments of our students with disabilities or students who may have a disability and that hasn't been determined yet. We can spend it on extra time to help get those assessments done. That's $719,000, somewhere around there. That's not enough for the long term, right?
No.
Because we know that we know we're going to be dealing with this for some time. So I was in a budget meeting yesterday with some consultants presenting, and they were very positive about the prospect of more federal assistance coming, targeted to helping schools in particular deal with reopening. We obviously see a whole whirlwind of political activity out there about open, don't open. It's really muddying the waters, I think, unfortunately, taking us away from science and too much politics, not blaming any one person. There's plenty of that to go around. So we do have money to get this started. We are concerned about the long-term ability to sustain without additional assistance. Yeah.
So I understand there's other pending legislation that might help with additional funding. It's called the HEROES or something along those lines. Is this something that, we as parents can call and say, hey, listen, I'm a parent of an elementary student. I want my kid to be able to go back to school, but I want my children and my community to be safe. Please fund healthy, safe school reopening. Is this something that we should be calling and really letting people know that this is important to us?
I think so, Betsy. And I think I saw come across the email in the last day or two, a potential resolution, might have been from, I can't remember if it was Administrator Association or maybe School Board Association, but a potential resolution that the board could adopt expressing its support for those types of measures, and it might have been a specific one. And then, of course, we can use that kind of thing and communicate out to our parents and community as a whole about emailing or calling their legislator to support these things. So yeah, this is going to take all of us, including our input to the government, right?
And that concerns me that we work together to do the best that we can. And I had one comment about the increased contact with the teachers. I noticed, like I said, I do have a little one. She's in second grade. Last year she was in second grade. And my kids have pretty long attention spans. But I found that any Zoom meeting that was over half an hour stopped being productive after a while. And that was not just for my kids, but for the other kids. Because I'm lucky. I get to be at home. I get to see what they're doing. I'm a substitute teacher, so I've taught a lot of the things that they're learning. But from my feedback as a parent, when I was watching the other children, having more than half an hour at a time on a Zoom call just wasn't helpful enough. And I think that when you look at the recommendations for like the American Academy of Pediatrics and things like that, extended electronic media time is not the best practice. So I would hope that we would be mindful about how long our video interactions are next year.
I agree. Speaking as a middle-aged man, I have the same issues. more than half an hour becomes very difficult, but especially for our kiddos, it's a struggle. Yeah.
So that was my last thing, and thank you for being patient with me.
Thanks, Betsy. Who's next, Mark?
I have Maria next.
Maria. Is Maria here?
Maria is there. I cannot unmute her. Maria, can you unmute?
So we see you, Maria, but oh, there you go.
Oh, there you go.
Okay, can you hear me?
We sure can. Thank you.
Hi, how you doing?
We're doing like we've never done before. That's my standard answer.
My question is, my daughter's gonna be going to C.A. Jacobs.
Mhm.
This will be her first time in elementary, but well, you know, in junior high.
Mhm.
My question is that she has asthma, so
Okay,
she's a very high risk to be able to get any viruses or anything like that.
sure.
You know, she's very high risk to and potential to be able to get sick. So since she cannot keep the mask on for a long period of time because she feels like she's suffocating because of the asthma, so will she be able to stay home and do the distant learning and she'll still be able to get credit?
Absolutely, yes. You know, your question is a perfect example of a student for whom it's just not safe to be in the mix with all the other kids right now. And so distance learning will exist exactly for the purpose that you're talking about. So what you can look forward to is after, and this applies to everybody, after the board's decision on Thursday, that we will be mailing a document home, either for the document to be returned or for it to be sent electronically to us, completed electronically, where the families who want to choose distance learning will have to tell us that that is their choice. So the default, the automatic would be whatever, if it's blended learning, you know, participation in that mix of in-person and distance. If someone wants distance only, we're going to have you tell us that for sure. So look for that coming, hopefully in the mail. So our meeting is the 16th. We want to get that into the mail by the end of the day on the 17th. So it should hit mailboxes on Saturday, the 18th is what we're hoping for. And then you'll just need to make sure you return that. We're not going to give people a lot of time to complete those forms and get them back to us, because we have to figure out how many teachers we need to do what. But yes, look for that form. Anybody who's interested in distance learning, that will come right after the board meeting next week. Okay.
Okay, thank you.
Thank you. Who's next, Mark?
Sandro's next.
Okay.
Hi, I have a question and some input. So
Sure.
with this new hybrid type of learning, are we gonna have more, well, as parents, we have to be more involved with our child in his learning. So are we gonna be notified more on like class schedules or just class projects, homeworks through Dojo? Because that helps out a lot as parents, because it's hard to have communication with the teachers or even to get information from our students or from our children.
I think that's you're touching on one of the biggest needs of improvement for us, you know, and you know, we went from being in regular school on March 13th in the morning to in the afternoon announcing that we were closing. And we had to stop using a model of education that has existed in this country for basically about 150, 160 years and go to this entirely online one. And talk about a shock to the system and talk about a real steep learning curve for us. One of the things that we know is that we have to have schedules for students, regardless of grade level, if they're engaged in distance learning. And we have to have those schedules available for parents as well. This was really tough on lots and lots of families, and we get that. And we're going to have to provide more structure in the program itself. Any element of distance learning, we have to provide more structure. And the communication piece is really key. So you could look for real improvement in both of those in this coming year.
Okay, well, thank you very much.
You're welcome. Thank you.
Candace next.
Candace, please.
Hi. So for the hybrid program, I wanted to make a comment that I think I would prefer morning or afternoons compared to full days.
Okay.
And then not being there for days. And then quick question, will you guys be trying to match schedules with siblings?
Yes. Yes. To the full extent that we can. We know that there's a great deal of challenge call it inconvenience if you'd like, for families and what happened over these last few months. And we got to try to find ways to minimize that. Nick, I think, mentioned it earlier. I've heard him talk about it a whole bunch. If we were on an A and B program, so that some kids came Tuesday and Thursday and others came Wednesday and Friday, as an example, that if somebody had a student in an elementary school and somebody had a student in the middle school, that we would want both those children to be on the same schedule. So they're either both A's or both B's, right? So you're not dealing with having kids with different schedules. So that's part of the dynamic that we would be working on, is trying to align the schedules to make this as easy as possible for parents getting their kids to school and supporting them at home.
Awesome. Thank you.
You're very welcome. Thanks for the question. Who's next, Mark?
Sarah next.
Sarah, please.
Hi, can you hear me?
Sure can. Thank you.
Well, first I want to say thank you guys for your, I'm sure, your tireless efforts. I know that you haven't had a break, and just know that we appreciate all you're doing, even though I'm sure that you're getting a lot of positive and negative. So I want to start with that.
Thank you.
My second comment would be, whether I'm for opening all the way or all distance learning is irrelevant at this point. We have to do what's best for community. I guess my question for my child in going to distance learning is a very social boy who then is unsocialized. And so there was some mental health things that came up. So what are you guys planning? Is there going to be extra counselors available, as far as distance learning, Zoom meetings with the whole class versus one-on-one with the teacher? I know that that's kind of next steps, and I think that that's more where my question lies, to say what would be best for us. Can you just speak to that for me?
Sure, I sure can. Great question, and I appreciate you for surfacing the issue. As a district, we've been really pretty proactive in developing mental health services and social emotional education for kids over the last number of years, and we participate with Solano County Mental Health and Kaiser, and through the county office have pursued and been awarded a number of grants. So it's something that we're really proud of, and that we believe is critically important for students. We had a number of those services going on at the point we closed, and the families who were involved in those, students receiving those services at the time we closed, were able to continue with those if they wish to. And then kind of as identified, and this typically happened by principals or teachers, students that were having issues, some of them at least got referred in and got some services. It was damaging. I'm not going to understate it. The closure and the isolation was damaging to a lot of kids, and frankly to adults as well. A lot of staff members really felt a lot of pain and experienced real difficulties with the closure. We have to address that, right? Whether we're working with kids in person or whether kids are in distance learning, we have to increase the amount of support we're offering to students and families out there. These are really, really difficult times in a lot of households. You can layer on economic challenges to those learning ones, and we have a society right now that is, there's a great deal of unrest over issues around race and equity and such. So there's a lot going on, and kids feel so much of it, even when we don't think that they do. So you can look for some real direct communication out about how to access services. And we operate to a large degree on a teacher referral system, and we're going to have to move into an approach where more parents have an opportunity to kind of raise their hand and say, I think my child needs some help with their mental health or their social emotional condition. So I really do appreciate the chance to speak to that, because I think it's a really critical area for the reopening, again, whether in person or distance.
Okay. And then just a quick follow-up question. As things are unfolded, will there be a chance for us to say, you know, my child needs more one-on-one. My child is fine having, you know, a Zoom meeting once a week. So you can maybe make classes that are with the same like of student, or is that too much? As you said, there's only 21 days left. So
No, you know, and I think everything we can do in terms of those structures, we're going to engage in, and what, you know, what things will look like will depend. If we were, let's say with our elementary kids, if we were an AM/PM model, and for 4 days a week, then the teacher is going to see their students an awful lot on a daily basis, so that need would be reduced. If we're in an every other day model, then that really increases the time apart between a teacher and a student. And so whether it's gathering students in small groups, or having, you know, when a child is experiencing some difficulty, having a one-on-one conversation, it can be 10 minutes. I mean, gosh, I've been around kids for 32 years. Sometimes 2 minutes of discussion or conversation, encouragement, just help a kid deal with a difficult moment. So again, I think part of our improved work has to revolve around the opportunity for parents to say, my child needs something more, something different than what we're doing. And then it's, you know, it's on us to do our best to meet those needs.
Okay.
Knowing that there's limitations in all sorts of unfortunate ways, but yeah, we have to make this progress, and I'm happy to pass this part of our conversation tonight on next week to the board. I think it has to be a big priority for us.
Okay, and then the questions that Nick had on the bottom of his sheet were really great questions for each opening. Is that something that you guys actually want answered? Is that a next step as well? How can we pass that information or answering those questions along to you guys?
Yeah, great. So use that school closure at dixonusd.org if you'd like to answer those. We will be posting, so these meetings will get posted out on our website, and we'll post any related documents as well. So you can loop back there. Anybody can loop back there to see those, and please refer your friends and family who didn't participate tonight to go there as well. We'll post all 3 of those meetings up here in the next couple days as they happen.
Okay, thank you guys so much for your time. Really appreciate
Thank you. Appreciate your input. Who's next, Mark?
Shannon's iPad next.
Shannon's iPad.
Hi, can you hear me?
We sure can, thank you.
Okay. I had a little bit of a lighter question, but just will the kids be allowed to like play with each other on the playground or any kind of recess at all? Have we not gotten that far yet?
I'll tell you, I've been reading some things advocating for more free time and unstructured time for kids to socialize and kind of reestablish some of the norms of interacting with each other. And I read 2 or 3 different articles related to this. It has to get structured, of course, right? But kids have had a bunch of months here without fun.
Yeah, exactly.
To a very, very large degree. And we're especially talking about our elementary age kids.
Yeah.
You know, for the adolescents, they've been stuck in their phones and are interacting the same way that they do too much, right? For our younger kids, I talk about the damage element of this period. That's one of the areas of concern that I certainly have, I think we have. So yes, structured play, some elements of getting out or running around. You know, if we're in a mask situation, breathing breaks, right? Where you get to go out and take your mask off, spread out on the grass, and dance around or do a couple quick sprints or something like that. Those are going to be critical elements of getting back to business. Yeah.
Perfect. Thank you.
Thank you. School's supposed to be fun, right? We have to be able to restore some of that into the mix. We really do.
Awesome. Thank you.
You're very welcome. Who's next?
I have Michelle next.
Michelle, please.
Hi, good evening. I also want to echo what Sarah said just about how much work you guys have had to put into this, and it's a load that is just a lot to carry. So thank you. And thank you for this opportunity. On the board meeting last Thursday, it was very apparent that there needed to be a discussion of different age groups. There were some varying difference of opinion that were very strong. So I really appreciate this opportunity. The term breathing breaks makes me feel like, what is this world that we're living in? Like,
Right. Yeah,
it's just,
right.
I wrote it down because I don't want to
Right.
forget it. So I'm not a math person, but I love data. And I have spent some time the last couple of days looking at all of the COVID data in our county and in our city. And I think it's so easy to get distracted by big numbers and rising numbers, but I think it's really important to look at the big picture. This is not to discount the seriousness of this virus. I understand it, and I've been doing everything I can for my family to limit and lower our risk. But I think it's important to know that half of 1% of the county in general, if you look at population of Solano County and the number of cases as of today, half of the county, half of 1% of the county has had COVID. Half of 1% of the population of Dixon has had COVID. And that's, to me, I know there's risk, I get it, but it's a very small percentage of an entire population of people. And our young people, it's a very small risk. So I wanted to start with that. I also want to say I have a very different perspective, and I've said this in other board meetings, that I sent my child, who will be in first grade, back to daycare in May. She has been going to a daycare in Dixon that has never been closed this entire time. They stayed open. They had a very small number of students. That number has increased. I believe that her school age class is now up to 15 students. They started with about 5 during the beginnings of this closure, but they are back to 15 consistent students in the class. The director made the decision that the students don't have to wear masks. The teachers have been wearing them since the state mandate, but the students don't have to. And they're doing their best to keep the kids in small groups, but they're 6 and 7 and 8-year-olds. It's very difficult to do. I think for our young kids, consistency on campus is so important. The 2-day model terrifies me. I just feel like it's not enough time for them. My daughter has a lot of stranger danger. It takes a while for her to warm up to people. I feel like it would take weeks in school to feel comfortable if only going for 2 hours a day. I know a 4-day-a-week schedule that Vacaville's doing. I just looked, and it's only 2.5 hours on campus, but the 4 days is key. And even with all the precautions, I know for me, I would love to be able to have her on campus 4 days a week. The 2 just seems like it's just not enough. It's just not enough. If that is the choice, I feel like the back-to-back days for that consistency in the schedule would be ideal. But thank you again for your time and everything that you guys are doing. It's very appreciated.
Thank you.
Hear from you again, Michelle.
Thanks.
You're a regular on these things, Michelle.
I am. While managing my children in the background.
Michelle, I'm spending more time with you than my wife. Out loud, so.
Well, my daughter, Mr. Dolan, I have to tell you, my daughter, you told her that your fun name was Mr. Donut at Tremont one day, and so that's what she knows you as, Mr. Donut.
Mr. Donut tells the sweetheart hello. Thanks, Michelle. Thanks for some fun in the midst of this, right? Yeah.
I have Kayla next, please.
Kayla, please.
My question is in regards to Sylvieville. I feel like there hasn't been much information released as far as that structure, because I know my daughter, I have one that's in Sylvieville and another one going into First, and I just haven't seen any guidance regarding that, and I would just like some clarifications, because I feel like that they've been getting left out a little bit.
Sure. Yeah, and that's a correct point. We have not emphasized, and you're talking about the preschool program, correct? Or are you talking about Dixon Montessori? Talking preschool program?
Preschool program.
Yeah.
Yes.
Okay. Kim Parrott, are you in the meeting?
Yes, I'm here.
All right. Kim is our special education director. If you don't mind talking about preschool program a little bit. Thank you.
Right. The preschool program right now will be following whatever the directive of the board is next Thursday. Excuse me, I've got dogs. We would be splitting the classes in half if necessary, if that's a direction, reducing the number of days. We're waiting to hear what the direction of the board is, at which point I will be meeting with the preschool staff, and we will then attempt to follow the model that the rest of the district is going to be following. As you know, our preschool classes are small anyway. They're normally 8 to 10 kids. Some we even start lower than that. So we're waiting to see what direction the board decides to go, at which point we will be looking at the numbers of the students that we have that are registered at the preschool. Majority of them do have IEPs, but we do have parents that are on the wait list that want their children to go there that do not have IEPs. So we're going to mirror what's happening in the district. If we do go an AB model and there's siblings that are on an A model, then the preschooler will be on the A model. We will still be doing an AM and a PM session. There is a possibility with further discussion looking at the fact that we are a small group that will do a full AM and a full PM session because our group's so small. So I've got to look at the numbers. I've got to look at the direction that the board recommends that we're going as a district next week, at which point I will sit down with Sabrina and Blanca and Gabby and the preschool staff, and we'll look at the numbers that we have at that time as far as enrollment, and determine if we're going to go the full 3.5 hours. If our numbers are already low enough, we may just keep the numbers low. So that's, I'm waiting to hear what the decision is so that I can look at the numbers and determine what would be the best way to service our preschoolers. But feel free to call my office.
Yeah.
I'm happy to answer questions and have been answering them all summer. So don't ever hesitate to get in contact with me.
Appreciate that clarification. And I also want to say that Sabrina and Blanca and the whole Sylvieville staff were just incredible when it came to the closure, and just were absolutely phenomenal, and they deserve so much credit. And I wanted to say that. So
Thanks, they're a great team. You're correct. Thank you, Kayla. Who's next, Mark? And I'm looking, there's about 14 or so people with their hand raised, just to give you a sense if you're not tracking that. I'm going to try to keep my answers as short as possible here. So, okay. Mark.
Damien next.
Damien, please.
Hi. Again, I appreciate Michelle's input of how small of a percentage that we're actually looking at of the population being affected by this. But I got to tell everyone that there's probably no one more concerned about this than myself and other parents who have children with pre-existing issues, like the mother that said her child had asthma. So my daughter has 2 autoimmune diseases. She is at extremely high risk of this. So I would want that choice to have my child be doing the distance learning, but because of her condition, like, she can't wear a mask, like asthma, she can't wear a mask, she would pass out. And now they can't attend school because of the mask situation. They're already being singled out. So it just kind of seems a little, it's sad in that way that we can't, some kids won't be able to attend, period. So you're going to have distance learning for some, which kind of just leads me back to my point of making it a decision by the parents which route they want to take for their particular situation, because in this, there's no blanket rule that's going to work for everybody. So having those options is key, in my opinion. And another suggestion for the distance learning is doing the Zoom. I know we want to keep our kids off of electronics, but we are making the best out of the situation that we are stuck with. And do you want to take the risk and send your child to school to possibly get COVID, or do you want to keep your kids home? It's a decision by the parents, but I would just want to reiterate, it's a low chance in our area.
All right, thank you. I want to we got a bunch of people, some of whom haven't had a chance yet, so I'm going to move on. Mark, who's next, please?
Saul Ramirez.
Oh, hi. I just want to comment really quick on the percentage that was said that right now Dixon has a 0.5% amount of people who have had COVID-19. That's wonderful, but the concern is once we open the schools, there is a possibility that if there is an outbreak within the schools, that number will rapidly rise. So just wanted to mention that. But it sounds like you guys are doing great things to prevent the disease, but I did have one question. Have you guys considered putting any high-grade MERV filters in your HVAC systems?
So Mark has been, part of his work on the safety issues, have been looking at things that we could do with regards to the HVAC. We've got a bunch of different types of units, and some of them are quite old, especially on the portable classrooms, say, for example, at Tremont, and some at C.A. Jacobs as well. We have a lot of portables there, some at Anderson also. So there are some complex issues there, also a lot of potential high cost elements, but HVAC safety is one of the things that we are investigating, yes.
Okay, good. Just because there's new evidence evolving regarding the potential of spread through HVAC systems.
Right.
This is an ever-evolving disease because it's so new. We're just finding out new evidence by the day. So I just wanted to make sure you guys are considering that as a possibility before you open, and maybe addressing the areas that you can.
Sure.
We are, and we currently use MERV 11 filters that get changed every 90 days based on the manufacturer's requirements. But thank you.
Okay, thanks.
Thank you. Next, Mark.
I have Blanca next.
Blanca, please.
Hi, I just had two questions. One was in regards to children who are already, that need extra help with their education, that are probably behind for their grade level. Is anything planned out for that? Like, I know my child used to get extra help throughout the day. Is there some kind of planning for that?
Yes, yes, there is. And exactly what it'll look like depends on what model we will adopt, right? And one thing we know we're not going to do is if there are students, well, we know we have students who need extra help. If it was a half-day model, we're not going to keep them for 5 hours a day when their peers go for 3, and then they're in essence, in their mind, being punished compared to their peers by having to stay the 2 extra hours. One of the elements of SB 98, the law that is directing our approach on this, is to provide the supports students with disabilities, English learners, students who are below grade level and such. So again, we made our best effort with those issues with this first round of closure. And whatever we're doing come August 10th, those services have to be better defined and more consistently and effectively provided to students. So you are very much on target with that question.
Thank you very much. I have one more question as well.
Sure.
I know that you guys said you guys would provide masks for all the kids. There are certain kids that I know of that are very picky with what they choose to wear and what fits good. Would they be able to take?
BYOM, yes, you can do bring your own mask as well. So we would not mandate that students have to wear a mask that we provide. It's there. If we're going to require them, we have to provide them, right? But it's not required that you wear a mask that we have available.
Thank you. Appreciate it.
Yep. Who's next, Mark?
Sarah next.
Sarah, please.
Hi, I have a question. So if we, for whatever reason, go to the hybrid model, will you be working with parents with kids at the Montessori and in the Dixon Unified School District?
Yeah, we're gonna actually, you just joggled my memory. I've been talking to Ben Ernest, the Montessori director, a little bit, and we're gonna meet next week. I got to get that scheduled. My team and his team to talk about coordination. How exactly things will line up, I couldn't begin to describe to you right now, but we are going to engage in some dialogue with them to make sure that we're aligned as best as possible, right? We know that we have kids in both systems. Some of that is, high schoolers and students in Montessori. Some of that is middle schoolers and such. And then we also know that we all live in the same one town, and the more consistent we are with our approach, I think the more support we'll both have with it. So yes, we are going to work together on that.
Okay, and I have another question, and I missed a little bit what the prior person was asking, and I apologize if you have to repeat yourself, but what about those kids that are on the 504 plans?
Right. So that has to be a ramped up effort on our part. We did make our, I think that students experienced a range of support from highly effective to not very effective, variety of factors in that. One of the things that is included in SB 98, the law that's driving all of this, is in essence improved provision of services to students who are eligible for them. So yes, have to be addressed.
Okay, thank you.
Thank you. Mark, who's next?
Jenny up next.
Jenny, please.
Thank you. Yeah, I just have either a question or a comment on the synchronous learning. I feel excited and terrified about that at the same time as a working parent.
Join the club.
If they're at daycare and there's 15 kids trying to get on the internet at the same time and they can't get on, or if the kids are at home and aren't going to log on without a parent being there, will they be marked as absent? Will they be able to make up the work? What is that going to look like?
Yeah, the quick answer is we're going to have all sorts of unique individual circumstances that we're going to have to address, right? And certainly we know one of the challenges are for families that both parents do have to work, whether that's outside the home or even inside the home. It's difficult to provide support for distance learning when you're trying to do your own job. We get that entirely. So I think there'll have to be some adjustments made on that case-by-case basis, dependent on a family's circumstances.
And then if I could just make a follow-up comment, I think I also prefer the being in school more days a week, but for shorter hours. I don't know, I think that would be how my kids would learn best as well and get to know their teacher. And at least daily have some face-to-face interaction.
Great, thank you. Okay, Mark, who's next?
Ryan's iPad up next.
Okay, Ryan's iPad.
Okay, can you hear me?
We sure can, thank you.
Okay.
Welcome back.
Technical difficulties. No. All right. Well, I'm actually glad I got to wait because both Betsy and Michelle voiced a lot of my opinions, and it was also nice to hear other people's concerns, because I think that what one woman said is it's really about community and what we should do, what's best for the community. I did want to bring up, kind of just to add to what Michelle had brought up, the American Pediatrics Association last week came out with a report that said that they strongly believe kids need to go back to school. They're very concerned about the mental health impacts and also the uptick in abuse. It's been a challenging time, and people make mistakes when they're in challenging situations. And so I just, you made the comment earlier that you're not a scientist, but I think we do have data and we do have scientists weighing in on this issue. And so, as much as possible, kids need to go back to what's normal for them. And I think that's really all that I wanted to say. And another thing was about parity. You brought up equity, racial equity, and what's going on in this country. The survey that you sent out was very limited, and I have to wonder if the people that decided that they don't want to send their kids back to school have a certain level of privilege over parents who have to work 2 jobs. We need to keep in, I don't. I have the privilege. You can throw anything at me and I'll be able to handle it, but that's not a community solution. We need to think of people who are less privileged that may not be able to have their child at home. And no matter what the law says, you can only give so much support to kids. I mean, you can have all the best intentions, but teachers are limited. They are human. You guys are all human. And so I just am concerned that kids that might have a tendency to fall behind may fall further behind. So that's all I had to say.
Thank you for voicing that. I oftentimes say, the Dolan kids would have been okay regardless. And the Dolan kids have had every benefit in life that a kid could ask for. 60% of the students who go to school in Dixon qualify for free or reduced lunch. And those kids have different lives than my kids did. So I appreciate you voicing that. Who's next, Mark?
If I butcher this, Waldeska.
Hi. Yes. May have been answered. I just wanted to recheck if the children themselves are potentially at high risk or high risk have conditions or unable to wear masks, or the family at home is at high risk based on pre-existing conditions and other issues medically. The option is there or would be there for distance learning full time. Is that
absolutely correct? Yes.
Even if the kid is up.
Thank you much.
You're welcome. Next, Mark.
Sarah next, please.
Sarah, please.
Hi.
Good evening.
Hey, so I'm just wondering, to be clear, there's not been something set yet as to how, whether that's,
nope.
Okay.
No, the board will make, I said this at the beginning, restated, the board will be making a decision on the model on Thursday evening of next week. And then we will flesh out all the details that we need to have based off of that. We're doing a lot of planning and preparation, but no decision has been made. We have not even made a recommendation to the board at this point in time.
I see. I think it's, best for us to get back to normal, get back to school. It's yes, everything has been said, it's been challenging and such like that, but also concerning like staffing, is there teachers, at all school sites, or is there, how do we, even if we're say it's distance, do we have people that can handle multiple children,
Right.
at every level? I'll have junior high and elementary.
Right. Yeah, and our staff wouldn't switch levels, anything of that nature, but the staffing component of this is very complex. And I just remind folks, just like families have issues related to health, whether it's the student or the parent, we have staff members in the same position. So we have a lot of work that we're engaging in here with our staff as well about how to support them with regards to all of this, and also have the right staff to be able to teach our kids.
How about substitutes? So say we have a teacher in there, but then, is there?
We're examining that one as well, including some conversation with at least one firm that you can contract out for substitutes if you really get into a spot where you can't get them on your own. So yeah, we're looking at that one too.
Okay. All right. Thank you.
Thank you very much. Next, Mark.
Mrs. Selmayr again.
I do apologize for coming back on. My prior district, we did distance learning via Microsoft Teams. And I haven't heard what systems your district does utilize. but I did hear some parents' concerns regarding being able to contact the parents, and I did find that system of Microsoft Teams to be extremely helpful and to be able for the students and teachers to be in constant contact. So more or less, I'm just throwing that information out there if it's not an avenue that you have previously considered or even known about.
Yeah, I've heard a little bit about it. We're using a Google platform district-wide at this point in time. So Google Classroom was one. A lot of Zooming happened, and a little tool in the elementary setting called Class Dojo. I don't know if you have any experience with it. That was an important link. So, but again, as we ramp up here, we're going to be looking at every possible option as to what makes the most sense.
Okay, I just wanted to throw that out there in case you did not know about that.
Yep. Thank you.
I have Kelly next.
Kelly, please.
Yes. Couple of questions. If you end up going towards some kind of a staggered schedule, say a Tuesday, Thursday, Wednesday, Friday, will there be any opportunity for families to petition for a certain schedule to help mitigate, say, daycare? If a parent's off on Tuesdays, to not have to take kids to daycare, you know, by having a Wednesday, Friday schedule, is that something that would possibly be considered?
I think we'll have to take those requests, Kelly. You know, our ability to meet all of them obviously is a whole nother matter, but you know, families are used to dropping their kid off at school 5 days a week and not having, so yeah, I think we would certainly have a conversation with anybody who is in that situation.
Okay. And also, has there been any progress in being able to help these families that do not have internet access at home? Yeah, I know there's still a lot of kids that don't have internet and they don't have the ability to get to town to a Starbucks every day to take care of that. And I don't know if the district's been able to negotiate
and appreciate the question. So we distributed about 1,200 Chromebooks out to students, families. And Mark, tell me the number, but we were able to also obtain and distribute some hotspots out to families.
So right now, I think we have 70 MiFis out being used, and we've got about another 60 in the office. So
right. And so with distance learning, any form of distance learning this year, we have to guarantee connectivity for a family, right? So we tried real hard, but at this point in time, we would have to ensure it. So yeah, appreciate that. That's another element of the equity question here, right? Is those families, yeah, for whom
and then just my last question. Sorry, my last question is, if we start back with some kind of a modified traditional learning in the classroom, and you know, heaven forbid things get worse, how quickly are your teachers going to be prepared, or is the district going to be prepared to transition immediately back to program any time?
Yeah, I think you got a little distorted there. Don't take that personally, Kelly. It was the connection. We're going to have to do it very quickly. You know, it took a while this past year because nobody was ready for it. And families had to, our staff had to get their own families situated and settled. It really has to be within a couple days, in my opinion. Yeah, right away. Yeah.
Thank you.
Thank you. Take care. Who's next?
Kara up next.
Hi, can you hear me?
We sure can, Kara. Thank you.
Hi, thank you. I had two questions. The first is about speech class. Now, my child stopped about 2 weeks before the school closed, and they recommended he be reassessed for the following year. So I was wondering how that's, if that's still a possibility, and what classes would look like if children are required to wear masks.
Great. Kim?
Okay. One of the things that we are recognizing, especially with our speech and language specialist and any of our special education staff that's going to be doing assessment, is that the kids are going to need to see their face. So there is actually, it's a shield that they wear. It's a headband, and the shield comes down in front of the face so the children can see the face of the person that is either assessing them or working with them. The other thing that we are also able to do, depending upon if a child is actually getting their speech and language services, is we do have teletherapy available for the child, so that if we do go to some type of a modified schedule, we would hate to be pulling that child constantly for a speech service and taking them away from what's happening in the classroom. So we're looking at all options as far as providing a therapy. But if you actually have a child that is waiting for assessment, we do have an assessment list of those children that need to be assessed at the different age levels. And there's a possibility, depending on the model, that we're making appointments for those kids to come in and to assess. But we are going to be assessing. We are staffing some extra staff in order to make sure that we can keep therapy going while also catching these assessments up. So that is something that has been a huge part of the planning this summer, and also making sure that I am able to secure from our non-public agencies the necessary help that we need to keep the therapy going for the students while catching up the assessments that we are behind on. And that also goes for the psychologist, and it also goes for the occupational therapist. So we are recognized in special ed that we are behind in assessment, and we have made plans to make sure that therapy continues while the assessment starts back up.
Okay, great. Thank you so much.
No problem.
I have Anthony up next.
Anthony, please.
Hello, how are you guys doing?
Good, thanks.
Cool. I think Kim might have actually answered part of my question. My son is currently on the spectrum. He goes to Gretchen Higgins, so he currently gets speech and OT and all that stuff. My son actually thrived when it came to the home distance learning. He actually did so much better with Miss Lori that I'm actually kind of hoping he can do it again a little bit for this next coming year. So and I do apologize, I didn't miss about the first 15 minutes of the meeting. So the whole plans you guys had, I kind of missed that part. Kind of sounds like you guys might be going towards some sort of hybrid where we might be able to stay home a little bit. My question is, if that's the case and you go that route, is there any thought to possibly having, for instance, my son do the hybrid stay-at-home model until after Christmas break and then go to the school once things slow down, hopefully, fingers crossed? Or is it a thing to where if he were to stay at home, would he have to stay at home for the entire year?
No, I think just on the preference or attendance model, I think that's going to have to be fluid throughout the year. We all hope that things clear up and we can get back to normal operations with everybody at school, and I don't think that's going to happen anytime soon, unfortunately. And even if the all clear was issued, we know we would still have some families that would want to be in distance learning, right? But I do think, let's say mid-year, if somebody says, I'm done with distance learning, I want to get into the hybrid program, we would be allowing those moves.
Great. And just as a little note as well, Miss Mac, Miss Trish, and Miss Lori, awesome rock stars. They're great. And so is Kim too. We've dealt with Kim a ton too. Kim is a rock star too.
Thanks, Anthony. Appreciate it.
Just to share, because I know this was a concern early, Anthony, because in the middle of the year we changed speech therapist at Gretchen. I do want to assure any parents that are out there that I secured every single speech therapist except one, and that was because she got married and moved away. Every single therapist we had last year, we have secured and brought back to district. So I'm trying to keep as much stability for our kids as far as therapy as I possibly could. So I did want to share that with you.
That's why you're awesome. Thank you.
Ingrid will be back.
Thanks. Next, Mark.
Maricela, please.
Maricela.
Hi, can you hear me?
Sure can. Thank you.
Okay, thank you for having this meeting tonight. I'm a parent of 3 children, 2 at the high school and 1 at Gretchen Higgins. And I have 2 kids with special needs, and my concerns are basically making sure that they're getting the services they need to continue with their education. And if kids go back to class, for my 9-year-old, he receives services where he gets pulled out. Have you guys thought about the planning as to how kids will be coming in and out of classrooms, transitioning to their resource teachers? In addition, my child takes medication, how that's going to be taken care of?
Sure. Kim, I'll let you address that one again.
It could vary by age level. In the secondary level, the children receive their specialized academic instruction as part of their class schedule. So that would be wrapped up into whatever their schedule is for the day as far as receiving that service. For elementary students, depending upon the model that we open with and what we're doing, it's going to affect maybe how we will be delivering some of those services. The model itself may be that part of their services are done online, while part of them are done while they're in attendance. The reason for that would be is that we would really hate to disrupt their time with their teacher. We also will continue to push at the elementary level. Our paraprofessionals will continue to push into the classrooms when students are in attendance. All the paraprofessionals have been trained in Google Classroom. If they miss the Google Classroom training, we are going to do a review of that. They, as well as a resource specialist, would be maintaining office hours and tutoring times where they would be available to also provide support for the students. And that would be all the way up through grade 12, that we would be having those office and those tutoring times utilizing the paraprofessionals and our specialists.
Okay. So will there be some type of flexibility? Like, I'm a working parent, and I'm lucky I work for a school district myself. So I was able to stay a couple of days home to stay with my kids, but then there were days I had to be at work to be able to be with my children when they need to connect to the devices.
Mm-hmm. Okay, so your question is assistance in helping them learn how to connect?
So having that flexibility of maybe I might not be there during the day, but once I'm home, we can have that connection when I'm at home.
We are going to be taping some lessons that the parent can access, but we would still want the student to be checking in at the assigned times. And the reason for that would be we're taking attendance. And so we need to have those instructional hours and proof of those direct contact instructional hours for the kids. But yes, I have been talking with the staff about some of our lessons. We're going to continue to try to tape and continue to try to create some type of a reference library that the parents can use not only during COVID, but even beyond this, so that they could work and support their students at home.
Okay.
We also are subscribing to several, K-8 is the only one that I know for sure, the ones we're getting. We're going to subscribe to several online platforms that the students can practice their skills through more game type formats and things like that at home. And that would be something that the parents could sign on with their child when they got home from work to help them with their skills.
And then I also have a question in regards to if there's a positive case in one of the classrooms, say a teacher or another student, how will we be notified, or how fast will we be able to know that, you know, kids maybe need to stay home and quarantine, or maybe we might need to close a class or maybe the whole school?
Yeah, so Solano County Public Health takes over in that instance. So we would be following their lead. They're actually doing that work. The contact tracing and all those different types of things fall under their purview. They're the experts, and we do what they tell us is how that rolls.
Okay, and then lastly, I just want to give a shout out to Miss Mack. She's been really awesome communicating to all the parents, and all the staff at Richard Higgins has been really supportive and trying to reach out to our kids and making sure they're getting the services they need.
Thank you very much.
Thank you.
Okay.
Andrew up next.
Andrew, please.
Hello. Obviously, I'm using my son's computer. I just wanted to thank you for holding this meeting. It's really, really important because I know, like many other parents of kids, that we are just feeling a little uneasy.
Sure.
And I just wanted to thank you for the options to be able to either distance learn or, you know, the hybrid models. So I've been taking a little notes here, and a lot of my questions were answered. Good. But I just wanted to put in that if we do the hybrid learning, I'd like to do the back-to-back, model there. And then basically just wanted to give a huge shout out to Miss Mack. She did communicate, pretty much every day, sending positive message with the little husky. And then Mrs. Erskine also, she was phenomenal. She, like you said, we had a, very quick turnaround time as far as, we pick up our kids and it's like school is closing. She had packets ready for our kids because we weren't sure how long we were going to be out. And then just the communication through the Google Classroom was excellent on her part. She sent notes to the parents. She communicated on Dojo. She had Zoom meetings, but everything was very thorough on the classroom Google when it came to Mrs. Erskine. And, she had her specific office hours, of course, that we could communicate with her independently, but just wanted to give her a really, a kudos for that. So that's about all.
Thank you for doing that. I don't see Ms. Erskine in the meeting. I do see Ms. McCammon. Chantel, I'll be stopping by the house to let some air out of your head after the meeting. After the meeting is over, if that's okay. Thank you for your kind words for them. They are great educators.
Yes,
for sure. Yep. All right. Next, Mark.
Lisa.
Hi, can you hear me?
Sure can. Thank you.
Hi, thank you. So I have a few questions. I don't know how likely the 100% model is, which is the one I prefer, but my concern with that is since Vacaville has already made their decision to go to a hybrid, so many hours, split model, is that they will be trying to do an different district transfer into Dixon.
Yeah.
And so, I mean, I know that's great because we have low enrollment, but at the same time, we don't want to overcrowd our classrooms.
Right.
Is that something we allow?
We're not required to either take a student in on an inter-district or to release someone to go to another district. There are some limitations on denying one. For example, if a parent works in the school district territory where they want to enroll their child, that's pretty much golden ticket. That said, and I do understand there's already some unrest in Vacaville, just as, this time next week, well, a few hours from now, probably our meeting will go long. There will be some unrest in Dixon. I really have a hard time seeing a lot of movement happen or intended movement. And I think, the districts in the county have done a lot of coordination on everything around this. And I think we would coordinate on that. It doesn't serve anybody's interest to have kids moving all over the county. Right now, Fairfield and Vallejo are intending a full physical reopening is what they previously determined. I don't know if they're revisiting that or not. So you could potentially draw some people wanting to go to school there based on what they do as well. But I'm not too concerned really about movement between districts.
Okay. My other question was with the all distance learning, I know you said that that's an option for those who have pre-existing conditions or, medical issues. But is that also a choice for someone who doesn't have any medical reason not to go to the school?
Yeah, there's no expectation or requirement that we verify the basis for anybody's request for distance learning. So no, people would be able to make the choice without us conducting an investigation as to whether there was a real issue or not. We understand people have all sorts of reasons for perhaps wanting distance learning at this point in time. So the option will be there for anybody.
Okay. And then I just was curious because, I'm part of the PTO. Is it already been determined that there will be absolutely no field trips, no events?
No decisions on those things yet. No, none whatsoever. All those events will depend on the circumstances as we get to them and what kind of guidance or restrictions are in place. But no, nothing such as that decided at this point.
Okay. And then the last thing was I just wanted to note that if we do the, hybrid model, the 50% model, that I would prefer more days with less time as opposed to like a Monday, Tuesday, Wednesday, Thursday type model.
Great.
That's just my preference.
Thank you, Lisa.
Thank you.
I think I have the Brown family next.
Okay.
Hi, this is Isaac. Hey, Brian.
Hi, Isaac.
I just one bit of information just for the folks that are on the call. So I work in hospital operations. I know that there's concerns about the numbers that have been out there that's been stated. Right now at North Bay, we have more people with COVID in the ICU than we've had this whole time. So there has been, we've seen an uptick, whether people are into the numbers or not. The highest number that we've ever had is happening right now. So, and we're also seeing some of that migrating down to younger and younger folks, although the deaths are happening with the oldest folks. So those are a couple things to throw out there. Two quick questions, and this is, I'm not trying to be too far outside the box here, but for the families that have two parents working, has there been any consideration for having a later class time, maybe a 4 in the afternoon till 8 or 3 till 7 or something, where people could both work during the day and then drop their kids off for school? That's one question. And then also, are they looking at taking the classroom kind of outside at all to alleviate some of the needs for cleaning and having the kids get fresh air, all that type of good stuff? So thanks.
Yeah, thanks, Isaac. Second question first. Yeah, there's going to be a lot of encouragement for classes to get outside. Peggy Hart, one of our teachers, science teacher, is doing a little bit of work related to that. And I forget, Peggy's in the call, I forget who the group she's working through that with. But definitely, you know, I think going out and sitting under the tree for reading rather than clustering in the classroom, some of those types of things. The other question about kind of swing shift, for lack of a better term, teaching, you know, we do have obligations with our labor partners, the Dixon Teachers Association, you know, regarding a duty day, and we would not be able to pull off that type of approach of having evening classes there. We have a duty day that you know, essentially is an 8 to 3:30 duty day for staff, and you know, potentially could there be somebody volunteers for that and wants to do distance learning in that model? Potentially, but again, that's something we'd have to come to agreement with, even on a volunteer basis with the association. So complicated, but it's an interesting idea. Kind of intriguing, really.
Okay, thank you, appreciate it.
Thank you.
Thank you for all you guys are doing.
No, thank you. Jenny, I see Jenny is our last one, and we've been at it for 2 hours and 10 minutes, and we're down to our number of participants almost at 100. So we will take Jenny's question or comment and then wrap it up. So Jenny.
Thank you. Just one more question.
Sure.
I did have one student that's pretty young. He was in first grade, and we had a really hard time with the computer stuff. He didn't do a lot on the computer before. I'm pretty sure he still doesn't even know his password to sign on, even though it's, you know, a birthday and numbers. Will there be more packets that we'll be able to pick up for the younger students? You know, more just handout type things.
Yeah, that, you know, that's a need that we heard from a variety, you know, a significant number of parents, and certainly for younger kids, if we're in a hybrid model, I would expect that it would be much easier and practical to be able to send students home with packets of work than it was when we were in total shutdown, right? I think the distance learning model, you know, would be very heavily computer-based. That alone, a standalone distance learning model, not necessarily exclusively, and obviously it's different the older kids get. But I think in the hybrid model with all students, but especially for the younger ones, you could send work home in workbooks or packets and kind of get them off the computers as much as they were expected this past year.
Thank you.
Yeah, great question. Thank you. Okay, so gosh, thank you, everybody. I you know, heard some questions and comments that kind of triggered things I hadn't thought about yet. We do have a board member or two who has been sitting in this meeting, so I won't be the only person, Nick and Mark and I won't be the only people conveying some of the thoughts that came out of this today. You are welcome, if you like, just for fun, if you don't have a secondary age student, to come on into Monday's meeting. It'll be the same except till we get to questions and answers. You know, we didn't have any discussion about grades as an example in this meeting, which are very important topics for high school age parents and guardians. Again, next Thursday, beginning at 6 p.m. is the board meeting where a decision will be made. I do anticipate there will be a lengthy period of presentation and input before the board deals with the question at hand and makes the decision. Our Zoom capacity at this point in time is 500 participants. So hopefully we'll be able to get everybody in to that meeting who wants to get in. But just to give you a sense that we do have that many spots available to get into the meeting. So we encourage everybody to join in. We're going to be posting most of our backup, so the backup materials for that meeting after these parent town halls are done. So you can look for a general agenda posted tomorrow, and then more information that'll get out on the web on Wednesday morning. We just want to try to reflect some of what we've been hearing here. So thank you so much. Please feel free to email schoolclosure@dixonusd.org if you have any additional questions or concerns. And, you know, again, I want to encourage everybody, we got to do this together, and we got to be good to each other as we go through this. So thanks for your great input and questions tonight. Please take care, and we hope to see you all in our meeting on Thursday. Thank you, and good night.